We're made to believe that we're invincible, but it's not until you're faced with really difficult times and you realise that life is precious.
Adult male trauma.
He's got a partial degloving of both hands.
St George's, ETA 10 minutes.
He's got head on into a bus.
Almost totally amputated.
I'm not joking.
You're always so busy.
Well, they're open 24 hours, 7 days a week.
St George's, London.
Welcome to the madhouse.
One of Britain's busiest A&E departments.
Right, CT are ready.
We need 2 units of O&A now.
OK, this is really time critical. It's our job to look after you and worry about you.
That we're going to find out what's going on with you, OK?
Thank you.
A place where life...
Success.
Love...
She's all right. She's all right.
And loss unfold every single day.
Love you.
Filmed across one 24-hour period, these are the stories of a nation and its health service.
Very beautiful man.
I'll never fully understand how people manage to get through one of the worst things they've ever had to deal with in their life.
God, I can't believe this has happened. So brave, isn't it?
You see people from every single walk of life, and it makes you realise the common threads of humanity far outweigh any differences.
Society puts a lot of pressure on men. It puts a lot of pressure on them to be physically strong, to be emotionally strong. When you're faced with something potentially life-threatening, it can reduce you to feeling extremely vulnerable and terrified. Men will feel that they have this duty of responsibility and they can't be injured and they can't cry. I guess some people see it as a sign of weakness. Hello, St George's ED. Okay, go. So you're coming by air? Adult male HEMS trauma call, ETA 10 minutes. Can you activate the helipad?
A 24-year-old man is being airlifted to St George's. He was working on a construction site when he was impaled by a steel pole.
So the pole's gone in 10 centimetres.
Come out, just in there.
So he pulled it out himself, which never should do, because it might be stemming a big bleed, it might be stopping the lung from collapsing further.
The patient's mum is travelling by car to St George's.
The phone's rung, it's Mark, my husband. He said, right, Stan's got to be airlifted to hospital. I've gone into panic mode. I just thought, God, no, it's my baby, what's happened?
You've got at least 2 vital organs in your chest cavity, your lungs, your heart. So for there to be a foreign object penetrating that, it's an extremely serious situation.
So we've got a 24-year-old guy impaled on a metal pole at work. He removed the pole himself. We stop in here just so we can have a good look at the wound, get a chest X-ray before we kind of work out what CT we're going to do. All right?
Can we get some morphine out of him?
This is Stanley. He is 24. He was working on a scaffolding site, building site, and a metal pole was thrown towards him, so he was going to catch it. About a centimetre diameter metal went in approximately 10 centimetres. Injuries top to toe, he's got a wound about a centimetre in diameter. Lung was equivocal on the left side, up on the right, containing a stiffened pain on that left side.
Cool.
So we're going to do a quick examination again, OK? My name is Neil and I'm one of the doctors. We've got quite a few people here. Let's get the X-ray ready. X-ray.
Milan, do you want all 5 of morphine?
Yes, please.
Take a deep breath in for me. Hold it there.
Oh, he's got lots of subcutaneous emphysema.
Yeah.
Could you feel anything?
Yeah, there is something.
Hi, it's Sarah, one of the emergency consultants. It looks like he's got pneumothorax.
You've got multiple big blood vessels and arteries in that area. There's the risk of bleeding. There's the risk of cardiac arrest. You prepare for the worst. RCT ready?
Whoever wants to consider that scenario for anybody in your family, let alone your youngest child. Can't imagine losing your child. Children don't die before you.
That's it. Keep going a bit more. Well done.
24-year-old Stanley has suffered a penetrating injury to his chest after being impaled by a steel pole whilst working on a construction site.
Getting a really good story is to work out exactly what imaging we wanted to do, because depending on what arterial, venous, all those phases do, we can work out if they need any drains or anything.
Doctors are concerned Stanley may have damaged major internal organs.
I thought I could see the rim of a pneumothorax and maybe a tiny bit hazy.
Breathe in and hold your breath.
Stanley's family and girlfriend are on their way to St George's.
Me and Stanley were 16 when we met. We were at school. He always says he didn't, but when I used to leave school, he used to always just so happen to be riding his bike past. He had really long hair. Justin Bieber hair. That was definitely what it was like.
Definitely looked like some blood there. But...
When my mum first met him, she always used to say to me, "Oh, Millie, he's such a nice boy. Make sure you go out with Stanley. Make sure you go to the cinema with him on a date, because he's such a nice boy." I'd say, "Oh, I don't know, Mum, I'm not too sure," but he grew on me, I think. I always felt a bit giddy every time I saw him. It was all new and it was all fun then.
As soon as we get the scan results back, we might have to insert a small drain just to try and help reinflate your lung. We need to wait for the imaging to come back. Okay.
Stanley's mum, girlfriend, sister and family friend have now arrived in A&E.
You expecting this today? What's your darling?
Oh, I know.
My way.
When we met, he had ambitions. He loved football. On the weekends, obviously, he would play football when football season was on. He was good. He was good. They were actually thinking of signing him. He was so excited. He was hoping to become a professional football player. That was always what he wanted to do. He always said that to me.
Have you got any medical problems?
I had my legs rebuilt. That's it. I had really bad construction on my leg.
What happened?
I snapped every ligament in my right leg.
Was that an accident?
Football, yeah.
Football, OK.
On the game that the scouts were coming to see him, he actually had his accident.
It's just slowly getting worse and worse.
Is it just your chest, or is it anywhere else?
Just everywhere again.
He had a tackle, and one foot was above the knee and one foot below, and it knocked his knee out. It did everything that you could possibly imagine to his knee. And it was as bad as it could be. He had to have his knee rebuilt. He had to take hamstring from his good leg. Had a massive operation, big scar with staples, and he had to have a leg brace on for 9 months after that.
It's a bit better now.
Pain's eased up a little bit.
It all hit home once he had had the operation, and I think he just knew that the career that he always wanted, he wasn't going to get anymore, and they told him that he'd never be able to play football again. Your whole life is taken away from you, really. It destroyed him, I think.
Yeah, I like those shoes.
They're very nice. Nicest sandals I've ever had. Every time I go on holiday, I always take them. I always have them with me.
I've never known anybody so obsessed with his feet.
But one of the reasons is that I've got a lumpy growth there, you see, because of my arthritis.
Keith, I don't think there is anybody of your age who have feet as good as those. No, I don't, honestly.
Coming back through the Blackwall Tunnel, it was really huge, real stop-start. So it was quite mini. This bloke, when cars cut in, so they let you in. This bloke got out of the car, big bloke, and punched his car's window. And then got back in his car and drove off. That's scary. It was those sort of...
Just flare up so quickly.
Yeah.
Richard has come to St George's after being unable to straighten his leg. He's been joined by his wife, Angela.
My nickname's Beef. It's all I'm known as, apart from my mum, who calls me Richard when I'm in trouble. There was 4 Richards in my class in junior school. Frankland is my surname. It went to Frankland, Frankfurter, Beef Burger Beef. Everyone called me Beef. The nicknames work or don't work, I think, and it's stuck. I've never been particularly small bones, shall we say.
Richard. Come and take a seat, hon.
Thank you.
So, my name is Ali. I'm one of the emergency nurse practitioners. How can we help?
I've had, for a couple of weeks, all my joints have been really achy.
Okay.
And I've woken up this morning and I can't straighten any more than that without it being really painful.
Okay.
Really, really tender, sort of in there.
Okay.
Sort of around there.
Okay.
I mean, his knees have been crunchy probably for a good over a year, and you can hear them sometimes when he's walking up the stars.
Right.
It sort of almost sounds like something's gone in his knee.
Can I get you to slip your shoes off
Yes,
and pop on the couch for me?
I put my best trainers on.
Put clean socks on, I hope.
I did. Dad was a carpenter and joiner. We was really close, so we'd spend time in the shed. We'd, go and play cricket up the park. It was just a really good son-father relationship.
Just relax.
Yeah, I'm trying. We always did stuff together. I was his mate. That's what he called me, matey.
Go on, go on. That's not easy. Why is that not easy for you?
Because it hurts.
Where does it hurt?
In there.
Okay.
Right inside there.
So, do you have any pain around here?
I remember when I was probably 14, 15, I wanted a cabin bed. So with my dad, over several weekends, we made this hardwood bed, and it had my amplifier, my record player, my records, everything in this bed.
Any pain?
Yes.
Just bend your knee up for me as much as you can, darling.
My dad was a role model because of the support that he gave, really. He encouraged me in whatever I did to do my best at it.
Currently, I think you've got a knee sprain.
Right.
Okay. However, I'm not very happy with all this joint swelling malarkey that you're describing. So I think it's worth us taking some bloods and getting your rheumatoid factors done.
Yeah. When I was 13, my dad had a heart attack. Didn't die, he survived. It had been pretty massive. He needed a triple bypass. He was going into hospital that day and he sat me down at the kitchen table and gave me the son, you're the man of the house now. And he said, I don't think I'm gonna survive this. So you're gonna have to look after your mum and your sisters.
Let me just get one of my colleagues to take these bloods for
Lovely.
me. All right, I won't be a minute.
As a young lad, it was just like, no, I can't deal with this. Can't deal with it. Don't know what to do with it.
Police have urged motorists to avoid Croydon Lane after the collision between a Route 166 and a van just before 4 o'clock this afternoon.
The phone rang and she said, Max has had a crash. I drove where the accident was. All you can see is the back of the bus and you're looking at this van and this van's been cutting off.
A 28-year-old man and his 2-year-old daughter have been involved in a head-on collision with a bus.
I knew him and Darcy was in the van together and I just thought, how has anyone got out of that alive?
The man is being rushed to St George's, while his daughter is being treated at the scene of the accident.
St George's, can I help?
Adult trauma, male, 7 minutes.
He's a driver. What happened? They must have shared it. He's gone into a bus, head on.
Dr. Sharon is on shift in the emergency department.
Every time you go on the road, as a pedestrian or as a cyclist or a driver, you are potential risk of having an accident. I don't think we always think of that, but I think that's the harsh reality. Head-on RTC, car versus bus, a selection of injuries.
Max's dad, Robert, has travelled with him from the scene of the accident.
I was praying to God, take me and leave him.
Are they holding your head up?
So this is Max, he's a 28-year-old male. He is the driver of a van. He had a head-on collision with a bus travelling approximately 30 miles per hour. He has severe right-sided chest pain. He's got a degloving injury to the right patella and right upper quadrant abdomen pain.
In car crashes, obviously there's lots and lots of energy generated by the speed and then the impact the car makes. And when that energy is transmitted throughout the entire body and to those organs inside of you, then they can create a number of different injuries.
Just watch the right side is painful.
Lots of injuries to the chest, injuries to the tummy.
Because we're going to put you through the scanner, we will have to cut you short.
Unless you've examined them top to toe, you really don't know what or if anything has been injured and how badly. We're going to give you some antibiotics because there's an open wound in your knee and that's kind of connecting with your joint here, and you said you weren't allergic to anything at all.
Doctors need to order an urgent CT scan to discover if Max has any internal injuries.
He's got predominantly neck pain, pain down the right side of his chest, abdomen and right knee lacerations, so just head to pelvis, please.
Right. 3-year-old was in the car with him.
3-year-old?
Yeah, and he's also getting brought in another ambulance.
OK. Max, the child who's in the car, what's her name?
Darcy.
Is it my
little girl.
Was she front seat, back seat?
Front seat, with me.
In her car seat.
OK.
We'll keep an eye out.
All
right. The feeling of it, it's like someone pulling your heart out. It's horrendous. Just turned into an horror film.
The 28-year-old Max is having a CT scan after his van was involved in a head-on collision with the bus. His 2-year-old daughter, who was with him in the van, is being rushed to A&E in an ambulance.
In in car crashes, obviously there's lots and lots of energy generated. What happens is that everything still continues to move forward and then they're suddenly pulled backwards. And so anything that's moving inside of you can literally be torn off its attachment point. The heart can be torn off. You think the bowel inside can be torn. You get a spine, again, you worry that can be completely damaged and cause somebody to become paralysed for life.
Max's dad, Robert, is waiting in resus.
Breathe in and hold your breath.
If you could write down on paper all your faults, you would like your son not to have any of them faults. You don't want him to have to go through the things that you've gone through. I grew up in Mitcham, South London, quite rough. There was plenty of people willing to take what you had, so you had to keep what you had by fighting for it, basically. I didn't really like school very much, to be honest with you. I was always head of the queue for getting told off and being in trouble, you know. I was always fighting at school. I could read, but I couldn't write. Everything I wrote come out wrong. And to be honest with you, half the fights you get into is because people think you're stupid or something. I was a hindrance to the teachers to have there. So I think the fighting, they sort of looked at it as a way of getting rid of me. You can't believe the embarrassment when you walk into somewhere and you've got no education, you know. You go to the bottom of the list.
So have a chat. I think he's been through the scanner, hasn't he?
You all right? Yeah? Oh, mate, it's a good life out of me. When I ran out that road and I see that van, I thought, oh, my God. And I looked at you had claret all over you. Them little vans, mate, they don't hold up, do they?
So, I'm worried about it. I said to someone, I was like, bring the ambulance. She was all bleeding over me.
Max's daughter, Darcy, has arrived at St George's.
Let's sit you up. Good.
Darcy.
That's good.
Daddy.
Darcy's auntie is with her.
Have you been standing or walking since this happened?
Not really. Not really. All right, darling. All right, darling. Ready? All right, darling. All right.
Someone clipped her and got out and kicked the door open and took her to the side of the road. So she went all...
Aye?
She went all limpy.
Hello. Yeah, come through. Thank you.
Stanley's chest has been penetrated by a steel rod whilst he was at work. Doctors are concerned he may have damaged his lung.
You can see that this lung is slightly smaller.
They now have his CT scan results.
This bit is air. So subcutaneous emphysema is literally air under the skin. So that's where you can see it, because air is black. Sorry to wake you up, you're all right. So there's some blood in your chest, okay, because you've kind of hit the lung, all right, and then the lung's collapsed, okay, so there's a bit of air between your lung and your chest wall, okay, which is called a pneumothorax. We need to stick a drain in, okay, which kind of drains the air out and can drain the blood out, okay?
Thank you very much. Bye. A chest drain can be inserted to try and allow the air to escape and for the lung to re-inflate in order for the patient to breathe properly again. It's an extremely invasive procedure, But ultimately, sometimes that's what will save the patient's life.
So I'm just going to give you some painkiller here with the make a small hole and put a chest tube in. Yeah, all right. Has he had this before?
No, he had major surgery on his leg, and they had to
How did that
really...
happen? Was it after an accident?
He had an injury, but they did everything. It's this whole cruciate, anterior, arterial, anterior, posterior,
Okay.
get to have grafts and everything, yeah.
That's okay. If you need some more painkiller, we'll give you some more. Yeah, don't hesitate to ask.
When he actually had the accident with football, I think it did have an effect on his masculinity. I think it must do for anybody, you know, a big strapping lad like that, having something so important taken away from him, having a big leg brace on, losing a lot of weight. It must have taken a big knock on his confidence as well, I think. He was very angry at everybody. He got into a few fights with his sisters and with me as well, you know, arguments and things like that, just because he was so frustrated with the whole situation. I think he was a bit lost.
Okay. Shall I give you some more painkiller?
It affected him mentally terribly. If he couldn't play football, his life wasn't worth living.
His chest wall is quite big and muscular, so it's a bit further away than usual.
Yeah, he's normally boxing, so he's quite fit. The mental health team had to come out and speak to him because he didn't want to live.
I can't do no more. It's okay, it's okay.
As a parent, as a mother, nobody wants to hear that. The mental health team had to explain to him that your life is always worth living. You can't consider not wanting to be here because you've had this setback.
Okay, it's in now, yeah.
Oh, good, thank God for that. Oh, God. That was awful watching him go through that, bless him.
How this headache goes. And that cough. Yeah,
That's annoying.
Oh, cheers.
So what did you think of my Formula One driving? Did I get there quick enough? Hello? I'm talking to you.
Well, I was watching them two snogging. She is a big girl, isn't she?
Man, you can't say things like that.
Sorry, Richard, shut me down. So how long you been a Motorhead fan then?
Oh, since I was 14, I should think.
Oh, right, OK.
Nurses are giving Richard a blood test after he came into St George's with pain and stiffness in his knee and other joints.
His iPod has got to be the strangest collection ever.
Oh, really?
The stuff that's a bit weird, I quite like. Jazz, I like.
Do you know, I don't get jazz.
I play
Do
the
you?
guitar, so I think when you've been playing for so long, you just naturally get drawn to it because it's so interesting. It's not an easy listen.
It's not, is it? Why can't they all play together in tune? I think it would be my worst nightmare to go to a jazz club.
Would it really?
To be fair.
Oh, it's fine, that's all right. When Dad got ill, I realised he wouldn't be able to do some of the things that we did. OK, he survived, but it was one of those things that then just plays on your mind and you're always conscious of the health implications of that. My dad actually had 2 more triple bypasses in his lifetime. Being asked to grow up quickly when you're just hitting your teenage years and life's starting to get fun and interesting is the bit that's really hard.
Thank you.
Thank you.
It's all right.
I like life with my dad and my mum and family and my friends. I didn't want that to change.
It's always going to be worst first thing in the morning and last thing at night. always, because you're lying down flat all night. All right.
I drank quite a bit of alcohol. I remember going to the pub at 14 and being served in Maidstone. That was a bit of teenage rebellion. You get enough to blot out thinking about anything else.
I was thinking that it might be wise to get an X-ray of your knee done.
Yep.
Because then you'll have had all the investigations that your GP would want to be able to getting things kicked off for you.
Yeah. I went to a Sunday school and there was a lad that I'd never really got on with, and he'd just push, you know, little niggles and words. And he said something about my size. And I just stood up and thumped him in the face. You'd lose the plot and you'd have 4 people holding you back because you wanted to thump the living daylights out of him. Part of it was to try and get people to ask me what's going on. I wanted someone to say, how are you coping with your dad? I didn't know how to talk to anyone about it, so I just bottled it up. Oh, fun day.
Right, let's move this. All right. I don't know. All right, Mum.
2-year-old Darcy was involved in a head-on car crash earlier today. Doctors have ordered emergency X-rays to establish if she has any internal injuries. Her auntie is with her.
All right. All right.
Her father, Max, who was driving the vehicle, is being treated in resus. Doctors now have the results of his scan.
Yep, so it's back and there's nothing worrying on it, apart from you've bruised the lung a bit, as in, so they call it a contusion, so worried about where you're sore on that side.
That's all right.
The lung in that area is a bit bruised. We need to speak to the bone doctor about your knee. We're going to most likely do an X-ray of the knee, and then I'll see what she says about that, yeah?
Yeah.
Yeah. Yeah, let's get an X-ray first.
When Max was at school, I could see what was happening with him. Seeing him start sort of fighting and getting into trouble, you can see yourself in him, you know. It's like history repeating itself. He was always doing something wrong. There was always another phone call from the school. The truth of the matter is, if you start going down that road, he could have got in with the wrong crowd, he could have got in trouble with the police, and you don't want that to happen. That's why I went straight into the school and I said to the teachers, I'm dyslexic, my dad's dyslexic, and I think Max is dyslexic, and they got him help, and it straightened him out. He got let out of school on day release, he got put into the college for building and construction, and then he went into the plumbing. So it was channelled in the right direction.
Thank you very much. Cheers.
I wanted him to have an easier path, and the easier path is education.
My daughter was in the van with me. She's 3 Wednesday. She's here.
Yeah, look. She come for, they come for X-ray as well.
You all right? Come here. You all right? Don't cry, baby.
She's all right. She's all right.
Baby, I'm back in a minute, yeah? Mum and Nanny's with you.
She's all right, mate. All right.
He loves kids, so being a dad I think just come naturally to him. He provides for his family. I've ingrained that in him, that's what you have to do. He tries hard to be a good dad, and I'll take my hat off to him.
Come on then.
Baby, love you. You all right?
I just rotate your leg in
Richard has been sent for an X-ray after waking up this morning with a swollen and painful knee.
I was worried, certainly in those younger teenage years, constantly, about my dad's health. I certainly felt angry with the world. It was a bit of not knowing how to cope. That sort of cry for help, it was answered when I went into a youth club, and there was this one youth worker that got it. I can see something is bothering you. What is it? How can we actually take that and turn it into something positive? Thank you. He'd take us to festivals, which as a teenager was the actual ultimate thing. But there would always be times to chat, to say, what are you going to do with yourself in the future? Where are you going to go? What do you want to do?
Come in, come in.
As a young man, being able to have someone that you could just spill your guts out to and not worry about how it came out was amazing.
See, this bit here could be the startings of arthritis. So that could account for this horrible noise that you're getting. Things for your GP to ponder upon, I feel.
Yeah. He's pretty much why I do what I do now. You know, I got into youth work because he was the inspiration for it.
He may well send you up to the orthopaedic clinic and get them to have a little look. But we have done everything.
That's great. Thank you very much.
All right, take care.
Cheers. Oh, thank you.
See ya.
Yeah, see ya.
You all right?
It feels great to be given what I got, to stand up for people that are struggling, to fight for the underdog, to make sure everybody, with whatever they're going through, voice is heard and they're not put down.
Ready?
Doctors are examining Max's knee after he was injured in a head-on collision earlier today.
That's a bit grim too. That must have been on the dashboard.
Oh, dashboard collapsed.
What we need to do is get some local anaesthetic and numb everything.
Yep.
Then we can have a good old clean up, good old look around, make sure there's nothing serious.
His daughter is being monitored nearby in the children's unit.
How's you feeling yourself, though?
That's her. I'm worried about it.
She's right. She's right. Mum's with her.
I know.
All these tattoos.
Nah, it's different.
What? It's a needle in it?
Nah, it's different.
They all say the same, absolutely. Some people come in and have had lots of tattoos and actually faint with blood tests.
I never saved him. I just guided him to the right way of doing things. That's what I think every young man needs. He worked with me since he left school, father and son. We always used to have a laugh together, you know.
What?
I just can't, I'll just, about 100 years off my life. We used to do drain jetting. He was standing holding a hose and he pulled it out of the drain and it blew stuff. It blew stuff all over him. He wasn't impressed. I can remember that, yeah. Him getting covered in shit.
Let me know if I'm hurting you too much.
That's all right. Just see your finger in my knee.
You can feel it. You're weird, isn't it? A weird sensation.
Oh.
I know.
Could be worse, could be on your head.
Okay. Yeah, thanks, Doc.
On an emotional level, it makes me choke sometimes because you sit there and you think to yourself, he's become the man that I wanted him to be. Yeah.
You take care and
May
take
you
care
have a lovely
of
day.
Thank you very much.
Thank you very much.
Thank you.
Where is she?
In here.
What's happened? The lady has got a... Make sure you're all right, baby girl.
Max will be discharged from hospital. Doctors will keep Darcy overnight for further observation.
Peekaboo! Peekaboo!
I should probably stay up here with him. I'll even sleep in that room, I don't care. I'm not leaving him. I'm not leaving my baby.
Doctors have drained blood from Stanley's chest after he suffered a 5-inch penetrating wound.
He knew that he could never play football again, so he got into a bit of boxing. He went into a few boxing matches and went to the gym a lot. He got into it massively afterwards. It really helped. He did get a lot of his anger out, I think, which was good.
You're all right, mate. It's a significant injury. Yeah. Bit of a freak accident, let's be honest.
So how long do you think, how long is this normally,
Everyone's different. Sometimes it's just a couple of days, sometimes it's like a week, sometimes longer.
I've got a 10-week-old baby.
Oh, no, really?
Yeah.
Bless.
Well, we'll fetch Romeo out your first Father's Day, Bob will have to come up and see you, won't he?
When I found out I was pregnant, I was in my mum's bathroom. So I messaged him and said, we're going to need a chat when you get home, I think. And he messaged me back straight away and said, you're pregnant. Silly things. He was so excited about buying the buggy, buying the cot and things like that, which I never would have seen Stanley doing that before because it just was never him. Once we had it all there, I think he started to realise as well then, and he started to look around and think, I'm going to be a dad.
Just think of that lovely baby boy, eh? Your little boy. Hey, listen, we'll let you can still cuddle him and kiss him. We'll hold him and let you so you can do it with this arm. Once it's just this side, you'll be fine. Yeah.
Tattoos, muscles, boxing, football, it's not anything compared to being a dad, and I think he's realised that now. You know, he says to me all the time that I don't think he ever expected to feel that way about anybody, and now that obviously he lost a lot, but he's gained 100 times more. He always says to me, well, I couldn't be a professional football player, but Remy will be.
Doctors will continue to monitor Stanley's chest injury to see if his breathing recovers.
I think for a man to become a father is a huge step in life. Suddenly, they're this role model, they're a father figure, they have responsibility that they didn't have before. And then the man realises that it's actually okay to be a little bit vulnerable sometimes, and it might actually increase your ability to cope.
When arthritis was mentioned, it kind of fills you with a bit of fear. A few achy knees certainly won't stop me doing what I do.
All I was worried about was Darcy. That's all that mattered to me at that point. I was laying there thinking, what would I ever do if you did lose my little girl? We're both very lucky, very lucky. She's your world, she's my little girl, you know? Everything I do is for her.
Obviously, it was his first Father's Day coming up in a couple of days, so to think that he wouldn't have even got to that point just to celebrate being a first-time dad, it was just horrific.
soon as the doctor came in, the first thing he said to me was, "You're a lucky boy to be alive right now."
He's Daddy.
It's not the way I wanted to spend my first Father's Day, but I was really glad to see him. I hope I'm a good dad. I'm trying my best. As long as I'm a good dad, that's all I want to be, is a good dad.